Hi everyone, Mike Pfeiffer, physical therapist here. Today I wanted to go over our top 3 exercises for lumbar stenosis and low back pain. Before we get started with those exercises, I wanted to go into a little bit of an explanation of what we're trying to achieve with these exercises and why we're doing them. So, what we're trying to do is increase our core strength. Those core muscles are made up of our abdominals and our back and hip and butt muscles. By strengthening those muscles help to support the spine and take some pressure off of that spine. So when you're doing activities that normally cause discomfort or pain or increased stress on your back, such as sit to stand, carrying, reaching, different activities like that, we're trying to get those muscles to help out that back as much as they can to take the pressure off and decrease that pain in the back. So, our first exercise that we're going to do is going to focus specifically and really lay the foundation for our core strengthening abdominal muscles. So you're going to lay down on your back with your knees bent, comfortable position, laying on your bed at home. You're going to tighten your abdominal muscles. You're going to think about drawing your belly button down towards the table, okay? So, one thing you could do to help get a better feeling for this is if you can get your hands behind your back to feel that, or you can put a little washcloth or something underneath there to feel if you're pushing your back down into the table. So you're going to tighten up those abdominal muscles, push your back down into the table, hold for 10 seconds, and then relax. Once again, you're going to tighten those abdominal muscles, draw your belly button down towards the table, hold, and relax. So I suggest doing 1 set of 10 to start. As that gets easier and as you're able to control that a little bit better, you're going to do 2 and 3 sets of 10 of those. To progress from that exercise, make it a little bit more functional. What you're going to do is you're going to sit down in a comfortable position. You're going to give yourself a hug, cross your arms across your chest. Sit, once again, tighten those tummy muscles. That's going to cause you to sit up nice and tall, good posture. You're going to hold those muscles tight as you slowly rotate from side to side. Now, this is not a full rotation as far as you can. You're just going to make small oscillations from side to side. The faster you go, the more resistance you're going to have. If you're having some discomfort with this exercise, you might want to either, 1, not go as far, so make it even a little bit smaller or shorter motions. The other thing you could do is slow down those motions and decrease some of the resistance on those muscles in back. So I would recommend doing this exercise starting off 3 sets of 10 of 25. This exercise, we're trying to get those core muscles strengthened, which are, those muscles work long term, so it's not like lifting weights or anything like that. We want these muscles to help stabilize through the whole day. So we want higher reps and lower weight. So that's why we're doing so many reps of this exercise. So those first 2 exercises are specifically working on the abdominal muscles and the core. The next exercise we're going to do is the bridge. With that exercise, we're going to focus a little bit more on the hip muscles and the back muscles. So as you're standing and carrying and doing exercise like that, those muscles will help you stand up taller and give some more support to the pelvis, which obviously attaches to the spine there. So with this exercise, you're going to lay on your back, once again, knees in a comfortable position. You're going to tighten up your abdominals like we have been doing, and you're also then going to squeeze your gluteal muscles, and you're going to lift up as high as you can and back down. So we want that back to stay straight as you're lifting, okay? If you're having some discomfort with this exercise, 1, make sure that you're contracting those abdominals and those gluteal muscles, and you're keeping those tight through the whole motion. If not, it can cause more arching in the back, and for stenosis specifically, that's going to cause increased discomfort. So 1, make sure that you're contracting those muscles. Number 2 is you might want to just not go quite as high to start, so maybe just go halfway and back down. So with that exercise, you can also start with 10 of those, then progress to 2, and then 3 sets of 10 as those get easier. So those are our top 3 exercises for lumbar stenosis. I hope you enjoyed this video and found it very helpful. Thank you.